In this video, we are going to talk about electrical cardioversion for cardiac arrhythmias. Many different arrhythmias can be experienced by patients. Some of them will be intermittent, some will be persistent. When a rhythm is persistent, rebooting the heart essentially back to its normal rhythm is called a cardioversion. This is typically done with electricity, although sometimes can be achieved with drug therapy. The most common rhythm for which this is done is atrial fibrillation. Whilst in many patients when this begins it might be an intermittent rhythm issue, in some patients they are found to be in it persistently, and in that setting we will often recommend that they have an electrical cardioversion in order to restore the heart rhythm back to its normal rhythm. A cardioversion is a very safe procedure. Patients do need to be on therapeutic blood thinners for this for a minimum period of 3 weeks beforehand, but as long as they are compliant with that therapy, then it is something that is done as a day case. Takes no more than 15 to 20 minutes to do as a procedure, where the patient will come in, have a brief deep sedation or anaesthetic from the anaesthetist, and then we will deliver an energy shock to the heart that will reset it back to its normal rhythm. We'll then wake the patient up, and then shortly thereafter they'll be able to go home. The cardioversion as a procedure will always work. It is very rare that the heart will not be restored back to its normal rhythm following electrical cardioversion. What will then vary is how inclined the heart is to stay in its normal rhythm thereafter, and particularly when talking about atrial fibrillation. And that is when we might be needing other strategies to help the heart maintain its rhythm after cardioversions. Because a brief general anaesthetic is involved in the procedure, it is generally advised that you do not drive for 24 hours. But other than that, the recovery afterwards is generally very uneventful, and you will often not even know that we've done the procedure. Risks for a cardioversion are truly minimal. As long as the patient has been therapeutically anticoagulated, so on blood thinners and not missed any doses, then the only risk is a risk of stroke, and that risk is substantially less than 1 in 1,000 for cardioversions. For a cardioversion, this is something that we will undertake as a day case procedure. You will come into the hospital beforehand for the necessary paperwork, but then when ready, we will bring you up to a room with the anaesthetist, where the anaesthetist will give you a very brief general anaesthetic and you'll drift off to sleep. We will apply paddles or patches to the stickers to the external surface of the body, and through these we will then deliver an electrical impulse that will reset the heart back into its normal rhythm. This takes probably about 10 minutes, no more than that, and then we will wake you up and recover you, and then shortly thereafter you should be able to go home.